Okay, so my name's Joanna Ellis. I'm the Operational Early Intervention in Psychosis Clinical Lead for Pennine Care. I'm a mental health nurse and CBT therapist. I've got some previous research experience working as a PI on two randomised controlled trials of psychological interventions where I delivered the experimental intervention. My project is preventing suicide in people at risk of psychosis. So this brief presentation covers how I use my time during the ARC-GM pre-doc fellowship. Psychosis is a mental health issue that causes people to lose touch with reality, often experiencing hallucinations, seeing or hearing things others don't, and delusions, strong beliefs that others don't share. People with psychosis can go on to develop schizophrenia, a serious mental health problem that affects 1% of the population. It's possible to identify and treat people most at risk to prevent psychosis. It's common for people at risk of psychosis to think about suicide and to attempt to end their lives. People at risk of psychosis are 12 times more likely to attempt suicide than the general population. It's not clear what leads people at risk of psychosis to attempt suicide or what the most effective treatments are. Routinely offered treatments have not been developed specifically for people at risk of psychosis who are suicidal, so may not address their specific needs. I used the 12 months during my ARC-GM fellowship to consider and develop the 5 Ps necessary for a DCAF award. So that's the project, the person, the place, publications, PPI. So at first I considered how I was going to use my training budget. So I used this to complete a research methods course at Salford University, as I wanted to update the knowledge and skills from my masters at Manchester University. This refreshed my skills in conducting systematic reviews, qualitative and quantitative research, and included additional training in qualitative methods and statistical analysis. I also attended the BABCP conference, and this helped me develop collaborations with other researchers and gain insights into academic poster presentations and how to disseminate findings. In terms of the place, I worked with my line manager, medical director, and the director of research and innovation to build a case for the trust to support me during and beyond the award. This is fundamental to your application. PPI, this was another significant component of my fellowship time. Initially, I conducted interviews with people at risk of psychosis. They were invited to review the study significance, the methods and engagement strategies for diverse backgrounds. Feedback influenced the decision to consider participatory research methods, as participants wanted more influence in their care decisions, and contributors received compensation through the Trust PPIE funds for their time. Following this, I successfully applied to the NIHR Increasing Capacity and Capability programme. This enabled further PPIE work with an ethnically diverse group of young people from the ARC-GM Young Persons Advisory Group, the YPAG. This session was held online with 15 participants and used visual art to capture and communicate key discussion points with them and other stakeholders, which is on the slides. The main themes emphasised the need for youth-focused treatments and culturally sensitive approaches to mental health, noting that recovery and stigma are often experienced differently across cultures. The young people described wanting to take treatment in their own direction and to write their own script. This work underscored the importance of engaging typically underserved groups in research, leading to a community engagement project, again with ARC-GM and Health Innovation Manchester. I collaborated with community connectors to reach 30 Black African youths in Greater Manchester. This group typically experienced poor health outcomes, including mental health. Black males are more likely to be diagnosed with schizophrenia and are more likely to be frequently hospitalised. Strategies to build trust and encourage participation, including involving religious leaders, engaging parents and placing posters in community spaces, which again is on the poster presentation. The project aimed to increase Black community involvement, gather feedback on the proposed research and understand ways to engage underrepresented voices in research to address the problem of missing data. Participants highlighted the stigma around mental health, noting its rare discussion within their community, and all showed interest in future research involvement. The success of the community connectors in this project shaped plans to use them in the upcoming co-design project. Outcomes from this engagement were presented at the Early Intervention in Psychosis Conference, Northwest PPIE Forum, and included in the Research Engagement Network report. Findings were also submitted as a case study to the Journal of Research Engagement and Involvement, sharing insights with a broader audience. I've also published a paper that linked to my earlier research experience as trial therapist and clinical supervisor in the British Journal of Psychiatry Open. So in terms of the project, different routes to PhD were considered over the course, and this was a dynamic process that involved regular supervision with my supervisors to consider what type of project would be the best fit for me and what I wanted to do. I've considered various projects, but I've since applied to the DCAF scheme, submitting the application yesterday. My research project aims to understand the best ways to help people at risk of psychosis who are suicidal, understand the experiences of people at risk of psychosis who have suicidal thoughts, and co-design with patients and staff an intervention for people at risk of psychosis who are suicidal. My project has 3 phases. Phase 1 will be a literature review, where I'll search for and review research literature exploring suicidal thoughts and behaviours in people at risk of psychosis. The learning from this review will be used to build knowledge of how to prevent suicide in people at risk of psychosis to support the next 2 phases of the project. Phase 2 will be interviews. Individuals who have experienced both suicidal thoughts and risk of psychosis will be interviewed to explore their experiences and priorities for support. Additional interviews with family members, NHS staff and policymakers will gather views on suicide risk factors, intervention priorities and practical considerations for implementing a new intervention in NHS services. And then phase 3 would be co-design workshops. Findings from the literature review and interviews will guide co-design workshops. This will bring together people with lived experience, family members and frontline NHS staff to collaboratively develop an intervention to reduce suicidal thoughts and behaviour in people at risk of psychosis. Key to my project is collaboration with King's College London. Because my project involves participatory research, namely experience-based co-design, I needed to develop links with a different institution where that is a research centre for mental health. So that has been key to my project. I found it extremely challenging at times, balancing work demands, protecting your work time, and that you need to get into a different headspace. So trying to juggle different things on the same day doesn't work. It's really important to ring fence that time as best you can. In terms of my supervisors, I couldn't have done this without their input and support. Professor Catherine Berry, Gillian Haddock, Daniel Pratt, and then my clinical supervisors, and then my links with King's. I'd like to thank ArcGM, Ross and the rest of the team for their fantastic support over the project and the opportunities and time it has afforded me. And I will wait to see how I get on with my DCAF application. Thank you very much.
Brilliant. Thank you very much, Joanne. That's fabulous and well done. It's no mean feat submitting a DCAF application. So we'll wish you the absolute best of luck with that submission. So you've had numerous successes again, you know, in terms of receiving funding, which is great, and your conference presentations and some great publications there. And some great advice as well. I think that's really sort of helpful for people to hear, our new kind of cohort of pre-docs and interns. It's wonderful. So I've got a question, hand up from Laura.
Hi, Joanne. That's brilliant. Really, really interesting to hear about the work you've done. I've just got a question about going forwards into your potential DCAF and trying to involve this sort of group in co-production and PPIE as well. Are there anything specifically you need to consider in terms of ethics using a group that are probably quite high risk and vulnerable, I imagine?
So the ethical considerations are, you know, they're articulated in the application. previous studies using participatory research methods, namely EBCD, they've found that you can interview and engage with groups that are at risk of psychosis, have have significant mental health need, but also risk of psychosis, and they've not found any adverse events in that group, so that you can evidence that that people can be recruited to participate in these types of projects, and there doesn't seem to be any increased risks to kind of talking to people about difficult experiences. And in terms of the development of complex interventions, it's considered a foundational step in that process to understand lived experience. So it seemed to be, when I did my literature review with the support of the librarian at the Trust, it was definitely a gap in the research to kind of understand how people relate to those particular experiences, and how they the interplay between psychotic symptoms and suicidal thoughts seemed to be underexplored.
Amazing. Good luck with your application. Thank you.
Thank you.
Any other questions? Can I ask, it sounds like you've done some incredible work in terms of engaging with underserved communities. How did you start that journey off? I mean, it's clearly led to a publication, which is fabulous, but could you just give us some insights into your kind of work in that area?
So fairly soon into the fellowship, there was an opportunity, increasing research capacity and capability funding. So I put in a bid for some money to do some PPI work, and was successful in that. So then I looked at working with ArcGM, so the PPIE, Anila and the team, to look at how they could support me to kind of engage with different groups. So psychosis typically occurs in adolescence, so it's typically young people that experience psychosis for the first time. So it's felt like the YPAG would be a good fit to kind of talk to them about the research question and the things that I'd need to consider to take the idea forward. That kind of highlighted the need to engage people from groups that are typically underserved in research, particularly mental health care and research. And then the area that I work with has higher numbers of Black, African and South Asian communities. So it was thinking about how I need to connect with those groups in particular to ensure that they felt that they could participate in any future project, and what the potential barriers might be to groups not wanting to participate or be involved. So the work that we did with the community connectors was really key. So the community connectors have built relationships up with groups in Manchester. And that was the engagement work that they did with religious leaders, going into mosques and community centres, navigating the different, cultural needs of those groups and being very sensitive to those needs. Really cultivated and fostered a lot of trust, which then enabled access to parents and then the young people themselves. So it was about ensuring that they felt safe to participate, and considering things like confidentiality and how the information that we were going to gather was going to be used. And interestingly, the group, what was some unexpected outcomes were that they disclosed their own mental health difficulties or peers' mental health difficulties, and that everybody at the end of the session wanted to participate in future research involvement. And because we did the group at the Manchester Business School, one of the business researchers came in and wanted to find out why so many Black young people were in the university, because she said, I've never seen as many people who look like me in the University of Manchester. And she gave this really absolutely influential speech to the young people about how important it was for them to not kind of get sort of weighed down by, she said that she was like, hey, we're all in a race and we've all got a different amount of luggage to carry, but we're all trying to get to the same destination. And she supported Black young people to complete PhDs. So she gave this extremely inspirational speech to the young people, which was an unexpected outcome.
Wow, sounds wonderful. And yeah, well done on all this great PPI work. It's really important. And we'll share your papers and the other papers that we've heard about today, I think, on our website or on our lifelong learning portal, because some really great lessons to be learned. Final question, if you don't mind. I can see on the bottom there's a little picture there, and I think it says compare and disappoint. What
sorry, I should have mentioned that in my presentation. So that was, I think all the people that have presented have alluded to the sort of waves of you kind of feel like you're making progress, you feel like what you're doing is useful, and then you kind of start to compare what you're doing to other people. You start to feel a bit despondent that it's not good enough. And I guess being a CBT therapist, that's kind of what we call an unhelpful thinking style. And it's just something that I found on the internet, and it's got some kind of things about research on it, and it just kind of illustrated some of the waves of the challenges that you go through doing something like this. But I'm just glad that I've done what I set out to do, which was submit the application to the DCAF. So I feel that's an achievement in itself.
Yeah, absolutely, it's an incredible achievement, and everybody today that's presented has shared such a wide range of achievements, but everyone's pathway is different. So yeah, you're quite right, not to directly compare. It can be our downfall. So thank you for that great advice, and